59-year-old male who presented for new glasses, and you look at the fundus and you see this. Anyone wants to try the diagnosis here? So what do we have before you jump into diagnosis? What do you have? You have an area of, what does it look like to be here? Aha. So we have bleeding on the retina. It's very localized. That's the most important. You can see a pattern. This, and also the pattern of the bleeding. Can you see it takes the shape here of the RNFL? Mm-hmm. What type of hemorrhage is that called? That's not the bleeding you see on diabetes. Diabetes is usually dots, right? The fact that it follows the RNFL, it means that it's on top of the retina, because the fibers are here. If it's on top, it's the blood is going to be between the layers of the RNFL, so it looks like it has the same shape. You see, all of them are like this. That's called flame-shaped hemorrhage. It just means it's superficial. Well, why would there be a bleeding and being superficial? Well, if the bleeding is coming from one of those vessels, then the vessels are on top of the retina. The bleeding then is going to be superficial. Okay. How can you get an area of bleeding, but just an area? Look at the rest. The rest is fine. There is no bleeding nowhere else. Why would you get an area of bleeding specifically? So here's the full story. There is a blockage of one of the veins. You know the difference between veins and arteries. Arteries bring the blood to the organ. Vein takes the blood away from the organ. Mm-hmm. So if you bring blood to an organ with an artery and then you block the exit, well, what's going to happen? It's gonna leak everywhere. On the retina, you know which one is the artery, which one is the vein. The arteries are the thin one. For example, here you see this is the artery, mm-hmm. and the thick one is the vein. So when you look here, you know that it's a vein occlusion because the blood is leaking. If it was an artery occlusion, the area will be white, mm-hmm. because there is no blood getting in. Mm-hmm. Here's the opposite. It's getting in, but it's not coming out. So it's just leaking everywhere. And in fact, if you look carefully at the pattern is this. Where's the blockage? Just based on the pattern, you can tell where's the blockage. The blockage should be here. If you just look at the pattern here. Now, if you look more specifically, you look at an artery, because you know this is a side effect of high blood pressure. Over years and years and years, the arteries are getting stiffer. It's called atherosclerosis. When the arteries are getting stiffer because of constant high blood pressure, they will compress. The wall will become stiffer and it will compress the nearby veins. Because arteries have a wall. They have a wall that can get quite stiff, but the veins don't. The veins are very soft, because they don't need to sustain such a high pressure, because the pressure is higher in the arteries and it's not as high in the veins. Mm-hmm. So if you look carefully, right here, this is an artery, this is a vein. But you see here, the vein here has a branch.
Oh, yeah.
Now look at this. It's squeezing it. You can see here the artery is passing through and it's squeezing that area. So that specifically, that branch, vein, is occluded. It cannot drain the blood properly. It's blocked here. So everything around that is bleeding. That's called a branch vein occlusion, because it's only a branch. You can have the central vein occlusion where everything is occluded. No, it's just a branch of the vein that is occluded. Branch retinal vein occlusion, or what we call BRVO, and it's occluded right here. Now, he's lucky because we didn't even pick it up on the exam normally, because the blood didn't get to the macula. It's barely getting to the macula if you look here. So his vision is 20/20.
Yeah.
I mean, if you do an OCT in this area, you're going to see there are pockets of fluid. Now, if you let the blood get to the macula further, then he's going to start to see blurry, because the macula is going to be distorted. There is something we can do when the blood gets to the macula. And guess what medication is this? It's always the same. There is an injection that we usually use for something else, but in that case it helped because it lowers the amount of leakage from blood vessels.
Anti-VEGF.
It's called anti-VEGF. Anti-VEGF also work in this situation. Anti-VEGF makes the blood vessels less permeable, so they will leak less. So as long as it doesn't affect visual acuity, they will probably leave it like that. But if you start to get blood in the macula and the patient sees blurry, and you inject anti-VEGF, and you will see the macular edema goes down.